Well, President Biden got the okay to leave isolation today. He returned to work in the Oval Office after finally getting a negative COVID test.
Biden credits the drug Paxlovid for helping him to beat the virus. Our Richard Giacobas is here now with a closer look at the treatment and if it's the right thing for everyone who gets COVID. Richard?
Well, that depends, Lori and Steve. You know, vaccines were once our only weapon to fight off COVID-19, but what our healthcare system was lacking was a treatment for this virus. Antiviral drug Paxlovid, proven to limit severe illness, was approved late last year to treat COVID. And President Joe Biden today says it was that drug, along with vaccines, that helped him make a speedy recovery. In his first public appearance in nearly a week, President Joe Biden made a fast-paced walk to the podium in the Rose Garden Wednesday, hours after testing negative for COVID-19, a virus the 79-year-old commander-in-chief says he's fully recovered from.
My symptoms were mild, my recovery was quick, and I'm feeling great.
The president, who is fully vaccinated and double boosted, says if not for the vaccines and the antiviral pill Paxlovid, he would have not been able to recover as quickly as he did.
I got through with no fear. A very mild discomfort because of these essentials life-saving tools.
Paxlovid was approved by the CDC for use in people with mild to moderate COVID-19 symptoms. According to a study from Yale University, it can reduce the risk of hospitalization and death in the most vulnerable COVID patients by nearly 90%.
Anybody who's over 65, people under 65 who have other medical conditions such as diabetes or who have cancer or have immune system problems. So anybody like that, including minorities who may be at high risk as well.
Doctors say Paxlovid also needs to be given during the first 5 days of infection to allow the body's immune system to fight the virus.
We're not seeing people getting admitted to the ICU or even to the hospital the way we did at the beginning, the first year of the pandemic. So the average person who gets COVID now will have a very mild illness, and if they take Paxlovid or one of the other treatments, they have an excellent chance of recovering fully and doing fine.
Now, some people who have taken Paxlovid have reported COVID relapse. Back in May, the CDC issued a health advisory letting doctors know about the potential for recurrence of COVID-19 with Paxlovid. Dr. Anthony Fauci experienced COVID rebound following treatment, but the agency still recommends using Paxlovid to potentially save lives. Lori, Steve.
All right, Richard, thank you.